our COVID-19 weekly meeting. We'd like to thank everyone for, again, joining us this evening. We have a dynamic panel tonight. We're going to be talking about, again, the vaccination sites, what we should still be doing. We're going to have an opportunity tonight with we got a guest here, Eric Willigis, that's with us tonight. And he's from the superintendent of Essex County Mosquito Control. And that's something we want to talk about early, because the summer months are starting to head in and we need to know what we should be doing. But also, let me introduce our, not even guest, but our team who has been working hard each and every day. And that's no other than our director, Monique Griffin, from our health department, along with her partner, Victor Cote. And they're both going to be giving you some updates on what's going on. Again, we're still at this vaccine stage here in Orange, and I know folks who are getting vaccinated and folks are vaccinated and got vaccinated, but we want to continue to make sure those individuals who haven't gotten vaccinated, that you get vaccinated. It's important. And I also want to talk about, and I hope Dr. Griffin and Victor can kind of work with me on this one tonight when we're talking about the vaccination, right? And it came over the weekend when I was reading the New York Post and the New York Times, that when we talk about the vaccination, we still have to be conscious of that there was many African Americans, when we talk about science, that was involved in the vaccine. So that's something we probably want to kind of talk about, not this segment, but I just want to put that on your mind, that we should be conscious of that, because we play a vital role in really the research. So, and Dr. Griffin and Victor really, hopefully we can have a segment on that one day, how important we know who was a part of the vaccination and this vaccine, from, the Moderna, the Pfizer, and the Johnson & Johnson, and I know that there's a new vaccine that's coming out. So with that, East Storms, let me give you the numbers for the day, then Dr. Griffin going to go right into the sites. We're so proud of our health department, really, because, last week alone, when they was working with FEMA and working with the Township of Orange and East Orange and also Irvington, they did a fantastic job in making sure that folks were signed up and folks was getting vaccinated with the vaccine. So here we go. As of today, March 31st, 2021, we have confirmed 6,354 positive cases in the city of East Orange and 276 confirmed with deaths. Now I'm going to give you the ward breakdown. We didn't get a ward breakdown last week, but we're going to give it this week. First ward, 1,001 cases. Second ward, 1,005 cases. Third ward, 1,155 cases. Fourth ward, 1,120 cases. In the fifth ward, 1,228 cases. In Essex County, there are 76,779 positive cases and 2,498 resulted in deaths. In New Jersey, the positive cases are 796,700 and 21,951 resulted in deaths. So again, these storms, we got to continue to stay vigilant. We know that everybody wants to get back to some normalcy, but again, we have to stay focused. So what I'm going to do, I'm going right into having Dr. Griffin, then Victor, and then I want to get into the conversation with Eric Willigis, who's the superintendent at Essex County Mosquito Control. We're going to have a conversation with him tonight, what we should be doing, what we should look out for. So with that, without further ado, Dr. Griffin, can you chime in on what y'all been doing with the vaccine, what our numbers look like, what we should be doing, what we need to do, and what direction that we're going here in the city of East Orange thus far.
Absolutely. Thank you, Mayor, and good evening. For the past 2 weeks, Victor, the team, and I have been working with, as the mayor mentioned, the Township of Irvington, City of Orange Township, as well as St. Matthew's A&E, and FEMA, and just multiple agencies to ensure that there was access to the Moderna vaccine among our communities. And the effort was extremely successful. We were able to administer the vaccine to over 3,600 residents, with a large majority of those individuals being persons of color. And we are committed to continuing that effort and continuing to identify opportunities and present opportunities for residents who are interested in receiving the vaccine to be able to do just that. I know that Victor can talk a little bit about some things that he's working on in the next couple of weeks, but we do have local partnerships that are going to also come to fruition and provide additional opportunities for residents to be vaccinated. And so what we would like to actually encourage our residents to do is continue to keep in touch with the health department. Call us at 973-266-5480 and just let us know if you are interested. We've received so many calls thus far, and we know that our residents are a little frustrated, especially if they've been waiting on lists for quite some time, whether it's a state list or another list, and they've been unsuccessful in accessing the vaccine. But let us know, because it's only by you communicating with us and also staying in touch with and monitoring our social media through City Hall that we'll be able to make sure that we convey a lot of the opportunities that exist to you. What we do know is that the county has also opened additional sites, and perhaps Victor can talk a little bit more about that. They've opened sites that are now available to educators. And while we've locally worked to support educators in becoming vaccinated, the county is doing a tremendous job in doing that as well. And it's not just for teachers, it's for support staff as well. So definitely visit essexcovid.org if you're an educator, if you are a support staff, and you are working within a school. And I believe it's K through 12. If you're working within a school building and you do want to become vaccinated, certainly visit essexcovid.org for additional information. I'll actually turn it over to Victor to talk a little bit more about some things that are coming up in the next couple of weeks.
Okay, Vic, give us an update on what's coming up, what's going on.
Thank you, Mayor. Good evening, East Orange. Over the next couple of days and weeks, we would be starting the vaccination for the homebound residents of East Orange. Our first outing will be tomorrow. We're going out to a couple of residences to vaccinate our homebound residents with the J&J vaccine, Johnson & Johnson vaccine. Also, just to inform our residents that the Essex County is vaccinating school teachers at this time at KMAT in West Orange, and also that the FEMA is opening a new site at the NJIT in Newark. So, and this is going to be more of a mega site for COVID vaccination. Also, starting on the 6th of April, we would be vaccinating residents who had received the first dose of the Moderna vaccine from the NCHC at the Campus High Auditorium for that day. And that week, we're also going to start the second dose of the FEMA program for the second dose of the Moderna vaccine at the St. Matthew's Church in Orange. Please, if you are looking to get vaccinated or you have family members who are homebound, please call the Senior Services Center of the Health Department at 973-266-8832 to have them registered, and would subsequently make provisions for vaccination for those homebound residents that are registered. It's the Johnson & Johnson vaccine that we'll be using, and it's coming from the Essex County Health Department. We are collaborating with them. And for those residents who are looking to get vaccinated with the Moderna vaccine, you would have to go to the FEMA site in Newark, the NJIT, or you go to the Essex County website, essexcovid.org, or call their number at 973-877-8456. Thank you.
Good. So Dr. Griffin, with the vaccination, I know last week you was on site over at the St. Matthew's Church, along with your staff. Give us an update on how things went up there with the FEMA and the other municipalities, and what's some of the things that we should be doing right now, if you didn't already talk about those who haven't received the vaccination. Victor just talked about that. Let's talk about our young people, how important it is for our young people to get vaccinated.
So to your point, Victor did mention a few dates. I can't stress enough that if you did not receive your first dose of the Moderna vaccine at either the campus location or the FEMA site, and you're interested in the vaccine, when we do reopen, that wouldn't necessarily be the time to visit the site. But definitely contact us at the health department, because we can make arrangements and we can share what the available opportunities are. Those sites will only be for individuals that were previously vaccinated. So I think it's important to stress that. As far as our children are concerned, right now the Moderna vaccine that we have access to is specifically for individuals that are 18 and older. So what we've been focusing more so on, and what we've been really happy to see, is the overwhelming response from our communities in coming out and in getting vaccinated, because it's by the work that we do as adults that we'll be able to foster that greater degree of protection for our younger ones. And that's why when we were looking at our educators, when we were looking at even parents and grandparents, there were a lot of individuals that were doing it not only for themselves, but for the younger ones that are around them as well.
Right. Is there is there anything new that is occurring in terms of making sure that our teachers, our younger people, school-age kids also, is anything occurring where they're going to get vaccinated also and getting the vaccine?
There are trials that are underway for pediatric individuals, but for our youth. And so as we see and as the research unfolds more, we'll be able to know more about how the vaccines impact our younger ones, those that are below the age of 18, or in certain cases below the age of 16. So until then, we won't really be able to say anything specifically, and so the focus will continue to be on the adults. But we're optimistic that we'll be able to know relatively soon what the impacts of the vaccines are, what protection the vaccine might offer our youth in the near future.
Okay, so listen.
In the meantime, I think it's
right. So listen.
In the meantime, I think it's important to just continue to protect yourselves. And you mentioned earlier that there are a lot of individuals that are becoming a little more comfortable because the weather's changing. We went through this last year, and it's important to stress, and Victor can probably speak a little bit more to it in terms of the numbers and what we're seeing, because while we're focusing on the vaccine and becoming vaccinated, it's very important not to forget about the fact that the virus is still circulating. And we understand that not everybody is interested in receiving the vaccine, and that's fine, but the virus is still here. And because the virus is still here, there's so many things that we need to continue to do and not forget to do, which includes the mask wearing, it includes social distancing, washing hands,
Yes.
and doing all the things that we've done to date.
And I think that's important, Dr. Griffin, because, you know, the weather is getting warmer. Folks ready to get back out. We've been talking about this, that the importance of that, continue to wear that mask. Please enforce and please enforce why it's important for parents, even though I know our young kids want to go and get in the park and get on the different playground areas. Why it's so important for us to kind of like, you know, enjoy ourselves a little bit, but not get too lax during this time, you know. And also, people that took the first vaccination shot at St. Matthews, what's the due dates for them to come back? So that's a twofold question.
Okay. I will answer the latter, and perhaps Victor can talk a little bit about some of the trends related to the virus. For those who received their first dose of the Moderna vaccine at St. Matthews, we will actually come back the week of April, or excuse me, beginning April 10th, to begin administering the second doses. So what will happen is right now, everybody that received the first dose of the vaccine at that site received a vaccination card, and on the back of the card it has a date on it, a date when they should return to receive their second dose. But there will also be an automated confirmation as well as a time that is sent via text and email to all of the individuals that received their first dose of the Moderna vaccine at that location, so that they have a better understanding of what time they should arrive at the site to be assisted and to receive the second dose of the Moderna vaccine. If for any reason anyone who did visit that location does not receive a text message or an email within the next week, I would even say 3 to 5 days, then they should definitely contact their local health department, and they'll make sure that we're aware. So for all of East Orange residents, if you received your first dose of the Moderna vaccine at that site, and for some reason within the next 3 or so days you don't receive an email or a text, please call us. You know, again, we say the number all the time, but please call 973-266-5480, and we'll make sure that you are aware of the time that you should arrive at St. Matthews. But I think Victor, you know, has certainly, with some other health officers, been monitoring the trends related to COVID because it's still here. And, you know, you're absolutely right, Mayor, that there sometimes is a false sense of confidence. Now that we're talking about the vaccine and the weather is great, we seem to forget all the things that we did to get to this point. But Victor, are you able to just talk a little bit about some of the more recent trends related to the virus?
Well, what has been observed with the virus is that there are new variants that have been detected, even in New Jersey, and these variants have led to upsurge of transmission in some municipalities as well as in some states. And I think this is very important for us to keep in mind, and not to, you know, relent on our efforts to keep protecting ourselves and our neighbors and our families. We have to keep up with, you know, washing our hands, using sanitizer, putting our face mask on, and especially maintaining that social distance of 6 feet from one another. And especially as adults, I think this has to continue until we get to that point where the CDC feels, you know, or feels otherwise, or gives us, you know, information on what the new situation is. But for now, we have to be careful because of the new variants that's coming up and that's ravaging the communities now.
So you know what that means, these stores? Let's not go backwards. I know everybody ready for some normalcy. We came too far. This has been a challenging last year for us all the way to date. Let's not go back. Let's stay focused. Let's do what we have to do so that way when we look up, I don't know how long the doctor's doing and follow the signs that we should be out of this, hopefully soon, God willing. But we have to do what we have to do to keep ourselves, our families, our neighbors, our friends, and our community safe. So come on, let's not go backwards. We're going forward. So with that, what I want to do very quickly, Dr. Griffin and Victor, we're gonna take some Q&A. Then we're gonna go right to Eric, who represents the superintendent at Essex County Mosquito Control. But I wanted to kind of separate the vaccination sites, what our numbers look like, the importance of us who took the shot, the importance of us going back in the second shot. Matter of fact, Dr. Griffin and Victor, let's talk about that. Some people, and I don't know who, took the first shot. If they don't go back and take the second shot, what is the effectiveness in terms of that first shot, but if you don't go back and take the second shot? Why is it so important? Victor or Dr. Griffin?
Well,
I'll start.
Okay, go ahead, Dr. Griffin, then we're going to let Victor chime in very quickly.
Okay. I was just going to say that, what we know is that you're not fully vaccinated if you don't get both doses of whichever the vaccine is, if we're talking about Pfizer or Moderna. And so when we know about the efficacy rate, the protection occurs after the 7 days after the second dose. So it is very important for individuals to make sure that they're fully vaccinated and not just focus most on the single dose. If it's a single dose, then hopefully that single dose is Johnson & Johnson as opposed to Pfizer or Moderna. Victor?
You just mentioned what I was going to say, especially that the second dose is a booster dose, more or less. What happens is that with the first dose, yes, you get some antibodies produced, but you want to boost that level to a higher level so that it can last longer, and so you get more coverage, and that is the whole purpose of the second dose.
Right, so it's important. And listen, we've been, honestly, I know that these shows have been consistent, and I know week by week you're probably saying, man, we're hearing the same thing, but that's okay, because I'd rather for all of us to hear the same thing week after week, time after time, until we get out of this pandemic, until we get out of having to take the vaccination, until we get out of having to wear the mask and practice social distance and staying vigilant. We're going to drive this all the way down the field till we score a touchdown. And that's what we want to score. We want to score the touchdown. And right now we're on the 50-yard line, but we're moving the ball up the field, and hopefully in a minute we can look up, and when Dr. Griffin throw up her hands and say, man, we scored the touchdown, and Victor and all the other experts, along with our governor and all the CDC, then we'll be where we need to be. But other than that, what I want to do, I want to take some questions. Precious, very quickly, if we have any questions from those folks who are on our Facebook page or Instagram, and then we're going to go talk to our good friend, the superintendent of the Essex County Mosquito Control, and have that conversation with Eric.
Yeah. Our first question is it still possible to contract COVID after getting the first shot? If so, do you still go and get the second shot?
So, Dr. Griffin, where we at with that? Can we still catch COVID after taking the first shot, right? Is there a chance for us to, to get to spread the virus?
Is there a chance? Yes. Even when we look at the efficacy rates, there are chances, but the chances are lower once you're fully vaccinated, or they're less if you're fully vaccinated, but it is still possible. And so even between the first and second, it is still very important for you to do everything that you've been doing to protect yourself thus far. If you're exhibiting symptoms of COVID, then no, it's not recommended that you immediately be vaccinated, and that's whether you're looking to receive the first dose or even the booster. But it is important that you're communicating with your physician, and also, even if you have an appointment, that you're communicating with the entity that is scheduled to provide you with the second dose of the vaccine.
Great. Precious?
The next question is, if you felt any soreness in your arm or fatigue after getting the vaccination, how long does that last? And if it's longer than 48 hours, should you contact a health official?
Did y'all hear the question, Dr. Griffin Vic? After taking the shot, do you feel any soreness, any stuffness in your arm, and it don't seem like it's getting better? How soon should you contact your provider, your doctor?
I would say this, every shot comes with some soreness. I mean, whenever you're stuck with a needle, whether it's for flu or whatever vaccine, you will get some soreness. But we all know that when you have soreness, swelling, lasting 48, 72 hours, and you don't have any relief, I think it's time to call your doctor and find out if you shouldn't be getting some other treatment for it.
Great. Any more questions?
Yeah. Is the city still offering transportation to the Essex County vaccine site for seniors?
Transportation from our senior transportation, Dr. Griffin. Is there a number that people can call?
Absolutely. The transportation services right now is spearheaded by Rebus via our Division of Senior Services. And she is in contact with the county, and she knows what the appointment availability is and so on. So if you do have questions, you can reach her or her team at 973-266-8832. But we are still providing that support for our seniors and residents.
Great, thank you for that. What happens if a person's traveling, right, the same day they take the second shot of the vaccine? Can they still travel, or is it advised to wait a few days or a week to start traveling? What is the advice for that?
It varies. So go ahead.
Go on.
Go ahead, Vic. You go, Vic.
Well, I see travel advisory in the sense that it's based on where you're going and what the recommendations are for where you're traveling to. So if you're traveling from one state to the other state, you worry more about what the recommendations are in the state you are going to and how it would affect you when you get there. Some would require you to get tested upon arrival and still be quarantined. They have different recommendations. You have to actually find out what is required, in the state or country you are traveling to before you begin to leave.
All right, you heard that, Tanya Harris, so you can't go nowhere. All right.
Within 24 hours, some individuals may experience or see that their body's working and working to absorb the vaccine, and it's responding to the vaccine. And so if you're traveling within 24 hours of receiving the vaccine, you want to be mindful of that, because there is, or what we have seen is that many individuals have experienced some reaction to it within 24 hours and then they subside. So you want to be mindful of that. Also, what we've learned is that there are individuals who may need to travel around the time that they expect to receive their second dose of the vaccine. And so again, it's important, if you plan on traveling after or during the time that you're expected to receive the second dose of a vaccine, again, whether Pfizer or Moderna, that you're communicating with the site, the vaccination site that you are scheduled to visit, so that you can modify the date of your appointment, the second appointment, either to move it up or possibly move it back. But in general, you do want to try to make arrangements for that second dose so that you don't miss it.
Right. All right, great. Precious, any more? We good? Thank you, Precious. Listen, to everyone that's joining us tonight, again, if you don't know, we are here for our COVID-19 virtual town hall meeting. Today is Wednesday, March the 30th. We thank all of you for joining us tonight with our guests, Dr. Monique Griffin, Victor Cote, and also we have Eric Willigis from our superintendent of Essex County Mosquito Control Agency. So what we're going to do tonight, we talked about the vaccine. We're going to come back to that, but we know that summer months are heading towards us, and we know that throughout the years, a lot of folks who really need to understand the mosquito population. So we wanted to really jump on something a little different tonight and have a little different conversation. But before we go off tonight, we'll take all your questions when it comes to garbage and debris. If you're having problems with rodents, we're going to give you those numbers out. But tonight, Eric, we just want to talk about the mosquito population that each year occurs in our communities, and what we should be doing and how we should do it. So before then, Eric, thank you for joining us, first of all, and we appreciate you. Eric, give us a little background about yourself, and then go right into the spiel of what the importance of, in terms of controlling mosquitoes in the community and what we should be doing.
Hi. Well, first, thank you very much for having me. I really appreciate the opportunity to come in and speak a little and talk to the residents and to you, about mosquito control and how we can all kind of work together to reduce as much as possible, which you do see. My background, I've worked for Essex County since around 2000, so a pretty long time now. I've been happy to be here. I caught a summer job working in Hunterdon County doing mosquito control and learned about it then. I've been kind of stuck here ever since. So I guess one of the big thoughts is, do mosquitoes transmit coronavirus is a biggie, and just, they definitely do not. That's a nice easy question. But they do carry diseases such as West Nile virus and Triple E that we do proactive surveillance for to try and help keep our residents as safe as possible from any sort of mosquito issues like that.
Right. And I'm glad you mentioned that, Eric, because with this coronavirus and this pandemic, we're getting into the summer months, and we want to take the myth off the table. If a person gets stung by a mosquito, do it carry the COVID virus? So that's good that you talking about that it don't. But what other diseases that it do carry? So Eric, give us an overview on when it comes to a household or apartment building. What's some of the things we shouldn't be doing that would generate mosquitoes in your yard or in your apartment building, garage, or where you have water? Give us some of the scenarios what we shouldn't be doing and how to make sure that if there's a population growing, what we should do.
So the biggest thing I can say in response to that, as a resident, even as myself, the best is just try and remove as many containers from your backyard as you can. Things like a bird bath or a children's pool, they're great to have. I have a bunch myself, I love them. But if you empty the water once a week, you're going to make sure no mosquito larvae can grow in there. It's going to have a huge help trying to keep those adults away from you throughout the summer. Really, I know it sounds simple, it sounds silly probably, but I promise reducing water once a week as much as possible is just a huge help in how we can all work together to keep you as free as we can from the mosquitoes we might have. But then also, please reach out and contact us. We are a county agency. We're here to try and help as best we can. So, I want to be able to work together as much as possible to speak to the residents and try and come out and inspect and see how we can just best work together to reduce those adult mosquitoes.
What's some of the things that we should be looking for around the house not to do? Sometimes people leave a garbage can out, and then the lid of the garbage can, when it rains, we leave it, and then it got water in it. Sometimes we leave our pools, during the winter and during the summer, where it can generate mosquitoes. What's some of the things that we should be looking out for, and what should be some of the best practice that will help us not to be able to generate all those mosquitoes in our yard? And, people, to practice social distance during this COVID, they are going to be doing a lot of things right at their house, in their yard. And, one thing you don't want to mess up your day or your cookout, with your family is mosquitoes. So what should we be doing?
So the biggest thing really to be doing is, I know I've said it and it sounds probably a bit much, but just trying to empty water, say, once a week. So if you have a bird bath, if you have a children's pool or something, if you can just turn it over, that makes sure the mosquito larvae can't grow in there. That means they're not going to be adults in your backyard kind of biting you or your friends or anything. It really is the biggest help. As far as like a swimming pool or something chlorinated, that means it's not going to be a good habitat for mosquitoes. They're not going to be able to grow there. So we don't worry about that as much. It's really small containers, bird baths, the water container underneath a flower pot or something. If you have an abandoned tire, you know there's an abandoned tire pile in the neighborhood, we try and remove those if we can. Again, just any small containers is really the biggest thing we deal with in some of the more urban neighborhoods.
What are some of the things that the county is doing to reduce, this population of mosquitoes? What local municipalities such as East Orange, we 3.9 square miles. We have a brook. We have over there by Washington Park. What are we doing to control the mosquitoes in that aspect?
So what we're doing is, having my inspectors out inspecting and seeing. We do have a bunch of sites we know might cause a mosquito issue, so we make sure to treat them proactively and try and get out there to help the residents before you're seeing adults, mosquitoes flying around. And then we try and make sure to respond to any service requests, again, as quickly as we can. Just, again, being proactive to try and find where they're coming from and reduce that source of water, and really make it so we don't have to spray as many chemicals as we want. We try and be as friendly as possible to keep that as low as we can by doing kind of a source reduction to try and make sure that there's no larval habitats there, as much as possible. It's not perfect, obviously, but it's what we would love to work together and try and do.
Right. Is there a number, Eric, that we can call or a homeowner could call when they feel that the mosquito population is generating and increasing? What number can we call to get in contact with your office?
So you can call us directly to Mosquito Control. It's at 973-239-3366. And then there's an extension is 2480. We do also have a website service request. It's at the Public Works website. It's ecdpw.org. And we try and respond, within 24 hours or as soon as we can to talk to the resident and see what's going on, and then send one of my inspectors out to best work together to see, how we can help, what really needs to be done to try and fix the issue.
Right, which is always good. So I want to kind of chime in on that, right? Because we got Anthony, who was on our Facebook page. We don't want him to fall asleep. But he want to talk about rodents, Victor. When there's rodents in a certain area, and all this goes together, mosquitoes, rodents, and Anthony is very concerned about the rodents around his area. What should folks be doing if they see rodents? What is the health department doing? Who they should contact along with the landlord? What should be the process?
Well, the first thing with rodent control is that when you have rodents around any neighborhood, there has to be harborage conditions. There has to be a source of food and water for those rats or mice to feed on or drink. Then they will come to that vicinity. If you can take care of those things, remove your garbage on time, don't let the garbage spill on the floor, don't let your dumpsters overflow, or you clean them up as soon as they overflow. Ensure that you don't have stagnant water. Don't feed cats, because when you feed those cats, whatever is left of the food you give to them, rats would come in to eat them up. So these are some of the things that we do that bring rodents into our neighborhood. And if we also can ensure that we have very good garbage cans that are very sturdy, very strong, that rodents cannot chew through, then we would also help to control rodents. Also, you have to look around your neighborhood. Overgrown weed is another problem. You have to ensure that the grass around your house is cut and trimmed all the time. And then you look for burrows. If you have burrows, then you likely have rodent issues. And you look for rodent droppings. If you have rodent droppings somewhere, then you have infestation. So there are other things that you may not see that could be dangerous in terms of rodents, and that is the urine. The urine is not that obvious. So whenever you have rodent issues, ensure that you get an exterminator to come and inspect that vicinity to find out if they can identify any rodent activities in terms of, feces or urination. You can use black light to detect that.
Right.
And so once that is detected, you can now begin to plan control. One of the things you want to do with control is first remove any harborage conditions. Any garbage or any dumpster that's overflowed should be cleaned up, and everything should be discarded as appropriately. Also, you have to get very good garbage cans and ensure that it's very sturdy and not easily damaged. And please put your garbage out at the right time for pickup. If you leave them out there for too long, sometimes for some reasons they might topple over, and again you have them spill on the floor and rodents would come. And if you're using garbage bags, what could happen is that you could have cats come in, rip the garbage bags open, and then rodents would come and eat through whatever is inside the garbage
Right.
bags. So timing garbage pickup is very, very important. If you have rodent issues, you can always call the health department, 973-266-5480, and we will send an inspector out, to inspect your neighborhood or your property and advise you on how to deal with rodent issues. If you have a personal home in the city or a private home, you need to call an exterminator. The exterminator would come, advise you as well. They will inspect your neighborhood or the surrounding of that area and advise you on how best to deal with rodent issues around that neighborhood. Also, apartment buildings, we also ask that you look in your basement. In your basement, that's very, very important. These are areas where you can have arborage conditions, because most times those doors in the basement open to the back of the building and they are kept open and not locked. So little things like that can bring rodents into a building. And also, if you have rusty pipes in your building, it's easy for rodents to climb up those rusty pipes and go to the apartment, upstairs. So there are many ways rodents can get to your house or to your apartment. You have to be vigilant, and if you call the health department, we'll have our inspectors come out and we'll give you the best advice we can. And if it's a vacant property or property owned by the city, the health department would go ahead and bait those properties and control the rodent population around those properties. You can also work with DPW. They will advise you on what garbage cans you can buy or they can provide for you to put your garbage in that would prevent, at least inhibit rodents from chewing through them and spilling your garbage on the floor.
Right. And thank you, Vic. We really appreciate it. I want to jump back to Eric. But again, you heard our health officer in terms of what we're doing on the city part. But again, East Orange, you have to do your part. Tell your neighbors, stop sitting the garbage out on the curb, and the garbage is not scheduled for that day, and the garbage sit out 2 or 3 days, and cats get in the garbage, and then that creates another problem with rodents being able to go in the garbage. Get the proper garbage can, put the bag inside the garbage can. We need your help. Do not be afraid to be our eyes and ears in the community by when you see your neighbor or your landlord not doing the right thing and not calling. Give the property maintenance division a call, and we're coming out. We cannot do this alone in terms of keeping our city clean and safe. We need everybody to do their part. We got to make sure that when we're walking down the street, we don't litter our streets. Put the garbage in the garbage container, right? We need you to do that. Don't take your personal garbage from your house, and you see the receptacles outside where we need the public to use when they're coming out of stores or just want to put a bag in there. Don't bring your personal garbage and put it in the receptacles. What that does, it fills up fast, and then people put garbage on top of that receptacle, and then it's garbage all over the place. So again, you know who you are that's doing it. Stop. Help us out. If we're going to say that we want to keep our city clean, we want to keep our city healthy, then we all have to partake in doing that. It's important. We want to make sure that when you call and we come out and do what we have to do by abating that area, you have to do your part too. So getting back to Eric, Precious, any calls on it? Okay, let's take some calls for Eric, Precious. Thank you.
Yeah, we have some questions. If you were looking to create any home remedies to abate mosquito problems, do you recommend any, or is chemical usage the only way?
So I guess the chemical usage isn't the only way, but the best kind of home remedy is reducing sources, making sure you don't have standing water in the areas. Especially the stuff we deal with in these type of areas, the species we have come from very small containers and very, very small amounts of water. The best way to do that without spraying anything is just to try and keep it, just empty things once a week. Like a bird bath emptied once a week, the water source under a flower pot, to just make sure nothing's growing in there will have a huge effect in the area. And then please, if it's not, please do call us. I would love to send one of my inspectors out to try and make sure we're not missing something. Make sure there's nothing bigger that we should be helping to take care of, and try and work with you a little more proactively to reduce the amount of mosquitoes that are there.
And can you repeat that number one more time for our viewers? They've been asking for it.
Yeah, you can get us directly. It's 973-239-3366. The extension then is 2480. And there is an online service request at the county's website. That's ecdpw.org.
Are there any chemicals that might be harmful to children when trying to abate mosquito problems in your home?
No, the chemicals we use, we try and be as safe and as environmentally friendly as possible. Actually, to control for the larval mosquitoes, we use, it's a bacterial product. We put it into a water source, and the mosquito larvae eat it, and actually they die from it. But it then breaks down in sunlight over the next 3 to 5 days. We don't have a long-lasting product we use that is now there all the time. So we try and be as safe as we can and apply to as small areas as we can, kind of making a targeted application to try and remove sources, not just treating all over the place.
And lastly, do any commercial mosquito traps work for your home or even business areas? Do you recommend?
I would not recommend, just because of a type of numbers. The commercial trap may attract some mosquitoes, but it's never going to be able to remove everything. If we can find where they're coming from and remove that, it would be a great help, but trying to trap them, once they're adults, there's just too much there to try and remove in that kind of manner.
Thank you, Precious, and thank you, Eric. So again, Eric is the superintendent at the Essex County Mosquito Control Department. And we wanted to bring Eric on tonight because we're starting to, get warm weather. We're starting to want to have conversations around, the city of beach storms, around our brooks, around our areas where it can generate mosquitoes. And we wanted Eric to come in and talk about what we need to do as a city to make sure that we do our part. Again, our part in making sure that when it comes to putting water out, letting the garbage can fill up and mosquitoes generate and breathe through that water. So Eric is here tonight to just give us a overview early before we jump into this summer, and also give us an understanding of what his department does for the Essex County Mosquito Control Division. So those who are just coming on, that's who Eric is, and he is the superintendent of the Essex County Mosquito Control Division. With that, I guess Eric, is there anything else that we need to know or should know? I mean, you gave us a lot of information. Again, Eric, can you provide your number again if a homeowner or building owner or tenant need to call you, what they should do, what number and what website?
Yep, the best to get us, it's 973-239-3366. The extension's 2480. The Public Works website is ecdpw.org. There's a service request form there a resident can fill out, and we will get in touch with you as quickly as possible.
Right, and thank you very much for that, Eric. What I want to do, I want to give out some numbers also to Anthony, who really have a concern about rodents in his building. Anthony, please call our code enforcement office, 973-266-5320. For us to come out, we need you to put in a report on what the concern is, what the issue is, so when that department get that complaint, we come out and we have a written document that folks are complaining. What we don't want folks to do is you know, not document that they have this complaint. If there's a complaint and you're a tenant, you have all right, when you're paying your money, to live in a comfortable manner. So again, Anthony, give us a call so we can come out and deal with that broken window, deal with those bed bugs and water bugs, and deal with the rodents. We need you to call property code enforcement. Also, the health department number, 973-266-5480. The health department. Also, our police department, 973-266-5480. is posted on our Facebook page. It's posted on tonight's meeting also. Public Works. If you need Public Works, that's DPW. That number is 973-266-5330. Please call that number if you have any issues with a light being out, the roads. We're doing everything we can to get these things done, but we need your help. You have to be our eyes and ears. Also, the Mayor's Office of Constituent Services. Please call 973-266-5151. And for any needs or any concern, please reach out to our department. You can speak to Tony Jackson or Justin Brown, and they will do everything they can to assist you with whatever. We're working together, all right? So with that, we're not going to be long tonight. I'm glad Dr. Griffin gave us such an update, and Victor, and along with Eric, in terms of the mosquito control here in East Orange and Essex County alone, which, you know, some people don't know what to do when they start getting a lot of mosquitoes. So we jumping on this stuff early, everyone. So what I want to do, Dr. Griffin, Victor, and Eric, we had a great, a good meeting tonight. It was very informative. All those who have joined us, again, I appreciate all of you week after week for coming on and joining us with the COVID-19 update. Look, any questions, any concerns, please call us, guys. We are in this together. We will continue to be in this together. But as I said earlier, we're on a 50-yard line right now, and all of us trying to score a touchdown. So with that, I'm going to ask Eric if you have any closing remarks, Eric, or any other things that you want to share with us before we close out. Then we're going to go to Victor, then we're going to go to Dr. Griffin, then we're going to close out tonight.
So I don't really, I guess the thing is I appreciate being here and
Yes.
being able to get in touch with people. You know, we are here to serve the residents. Please, if you're seeing any mosquitoes, if you're seeing too much, don't hesitate to give us a call or reach out online, whatever's easiest. We'd be happy to come out and send one of the inspectors to your home and inspect and try and see what's going on and how we can best work together to reduce any problems. But so really, thank you for having me. I really appreciate it.
Eric, it was fantastic, man. Thank you for being here with us. Our health officer, Victor.
Thank you, Mayor. I just want to remind everyone that this weekend is Easter celebration for those of us who are Christians, and we have to be careful. You know, whatever you do, please do not forget to maintain social distancing, use your face mask, have your hand sanitizer, and for those who will be traveling for the spring break, please, wherever you're going, ensure that you find out what the requirements are before you travel, and get tested for COVID before and when you reach your destination. And please, as you come back also to East Orange, I would say get tested when you come back and be sure that you're okay. And if you need to quarantine, please do so. If you're coming from a state with high risk COVID transmission. And also, please, again, I'm going to repeat this, keep your social distancing during the celebration period. Wash your hands frequently, use hand sanitizer, and use your face mask.
Thank you, Vic, very much. Dr. Griffin, can you close out?
Absolutely. And I definitely have to echo what Victor said. You've heard us. I can't stress enough the importance of following everything that Victor just said, but also I think it's important to remind our residents that even if you are vaccinated, it's still important for you to mask. It's still important for you to follow all the same guidelines until we get to a point where, as Victor mentioned earlier, there's a larger effort and notification that we can stop wearing masks. And the reason is because even if you take the vaccine, your protection may increase, but it doesn't mean that you can't transmit the virus to other individuals. So again, we have to continue working on behalf of the greater good and the larger community, ensuring that we're protecting one another as we move forward and hopefully come to a swift ending of the pandemic.
Thank you, Dr. Griffin. And really, I can't stress this enough. For your effort, your department, your staff, and the other departments who have been really on the front line from day one. We appreciate all of you for the tenacity. We appreciate your willness, and I know how much time it takes. So again, thank both of you for what you do each and every day, and all those frontline workers and all those teachers and property maintenance, our police department, fire department. We say this every week. My staff will really, I don't know what I would do without those guys, and we really appreciate everybody. All you who are part of our staff, we thank everybody. Listen, I'm gonna close out tonight. As we close out on the 30th of Women's History Month, right? I want to just close out because, we received information on the vaccine. We received information on the mosquito control and what we should be doing and what the Essex County Mosquito Control Division does. I just want to leave everybody with this. As we close out on the 30th of March, Women's History Month, first of all, I want to thank all the women for all that you do each and every day. I'm very grateful for my grandmother and my mother, although God called them, but I'm so grateful for them. But I'm grateful for all the women as we celebrate Women's History Month. And last month we celebrated Black History Month. I thank all of you for what you do each and every day. We thank you for your commitment. We thank you for your dedication. We thank you for always being the backbone of not only our families, the backbones of our community. We thank you for the profession that you chose to really do the things that drives our city and drive the state of New Jersey and drive really this nation and this country. There's so many things we can say as you celebrate Women's History Month. To me, every day is Women's History Month because we can't do what we do without all of you. And we know that for a fact. We know that you have been that nurturer. We know that you have been that person who always lifts us up when we need it. We know that you continue to do that. We know that you are that person who continue to aid to many people and never complain. We thank you for all your prayers and all your guidance. And truthfully speaking, I know for a fact that we stand on your shoulders. And I know that when God made women, he did not, he was not wrong, you know, and he did not make a mistake. So I just want to personally, as the mayor of the city of East Orange, just commend all the phenomenal women for what you do, what you continue to do, and what you are doing in this city of East Orange. With that, may God continue to bless you. May God continue to bless all your families. And may God continue to bless the city of East Orange. And just please follow us on our Facebook page. Please follow us on our Instagram. Please call those numbers. But I ask everybody, you know, if you're not going to uplift anyone, if you're not going to help anyone, then guess what? Then what are all of us doing in terms of moving our city forward? It's not about tearing each other down. It's not about us trying to find out who can hurt each other's feelings by words. This is all about building our community, showing our young people how to do it, and making sure that they understand the importance of being the future of this city. We should be bridge builders. You know, we should be those people who continue to help our sisters and brothers when they are in need. If you're about that, I'm about that. We're going to close out the night. Let's do what we have to do, East Orange, to make our city great as it is.